Hello, hello, hello. Welcome everyone to our monthly webinar. Thank you so much for joining us today. I can see everyone trickling in. We're really excited today. We have a very special guest whom I will introduce here in just a little bit. And Analia, who usually hosts our monthly webinar. Hello from New York City. Hello, New York City. Ximena, welcome. Sabina, welcome. As I was saying, Analia Lang, hello from Lexington, Kentucky. Hey, Anna. She is on a medical mission trip in Guatemala with Team Hope in Motion. So she is there all week. She is working as the interpreter for a team of medical providers that's doing or performing emergency surgeries, general medical primary care in Guatemala. So thank you all for joining us today. Just to run through a few quick updates as everyone trickles in. First thing, it's been 4 years since we started hosting this webinar. We started hosting the webinar about a month after COVID hit. And we were just checking a little while ago, and today marks the 4-year anniversary from when we started hosting this webinar. It's meant to be a free resource for the community, a way for everyone to get their CEUs, a way for all of us to stay engaged and connected. So thank you all for supporting us for the past few years. We hope to pretty much continue this as long as possible, as long as the community gets value out of it. So we want to hear from you. If you have ideas for webinar topics, if potentially you want to host a webinar, send us an email. We're more than willing to consider that. Otherwise, some CCC updates. The CCHI Summit was last week, which was great. Zach Williams, our manager of e-learning, and myself, we were there as a sponsor. I'm going to be at Gala next month presenting with Dr. Sofia Garcia Biarritz at Gala, and then the week after that at Kati in early May. Andrew and myself will be at Melfin in College Park, and we have Chia in May. Andrew and Analia will be there. In terms of our live courses, we will be running a live 40-hour version of the Community Interpreter in May. Analia is going to be teaching that course. We should have it up on the website. I know Andrew will be putting some links into the chat for that. So stay tuned for that. Additionally, what else? We are teaching holding space using our whole selves and mental health interpreting in June. In May, we're also teaching interpreting inclusive language. And then this coming week, we have medical terminology for healthcare interpreters. That one is actually completely full. That one is being taught by Cindy Rote. A little bit of housekeeping, just for everyone's benefit. Your certificate for this webinar will be going out within 24 hours, so tomorrow about midday. So if you could please download that within about 60 days. Okay, well, let's go ahead and get into our topic. I love seeing everyone come in and join the webinar. Hello from Minnesota. Hi, Luba. Good morning to all from Leominster, Massachusetts. Good morning, Monica Adler. Good morning, Veronica Piedra. Good morning, Sylvia. So we're really excited today. We have a very special host. It's actually Fabiola Munafo, who is the manager of language access services at Cincinnati Children's Hospital Medical Center. And she's presenting today. Her title is the presentation title is Raise Your Confidence, Critical Thinking, and Ethical Decision Making. So for those of you that don't know, Fabiola is also one of NCIHC's directors and a National Standards of Practice work group member. So they're actually revising our National Standards of Practice, so that'll be out hopefully soon. Fabiola completed her graduate courses for a master's in ESL at the University of Puerto Rico in 2009. She then became a legal interpreter from the state of Ohio And she became CCHI certified in 2017 and earned a master's in health administration in 2018. She has a PhD in business with a specialization in strategic leadership, which she finalized in 2023. So Fabiola is going to be joining us. You can go ahead and come on camera. Fabiola, welcome. It's so great to have you. So excited to listen to your presentation. Um, and Fabiola I went through Fabiola's bio briefly, but Fabiola is the expert on Fabiola. So she is going to introduce herself and take it from here. Thanks so much, Fabiola.
Thank you, John. Hello, everybody. I'm happy that you are here. I was going to say there's a bit of a typo on this title. It was supposed to be applying critical thinking and ethical decision making. So sorry about that. So as John said, my name is Fabiola Munafo, and I work at Cincinnati Children's Hospital. I have been an interpreter for about 15 years. I started as an OPI interpreter from Puerto Rico. That's how I started my career. And then in 2010, that's when I started taking in-person assignments. So the reason why I decided to put this webinar together is because when I started my career as an interpreter, I had many questions about how to make the best decision for the patients and the families that I was serving. And I often felt like I didn't have either enough guidance or I would often feel conflicted, and what I usually call like in a fog of guilt. Like I would make a decision and then question whether it was the best decision or not. And I would always leave, like sometimes, not always, but sometimes I would leave an encounter feeling like, you know what, I don't think that was the best choice. Or maybe what I did didn't match what my trainer said when I took my interpreting course. So then maybe I'm doing something wrong. So I hope that by going through the different elements in the code of ethics, that by reviewing what are the standards, what are the principles, I hope that you guys gain a better understanding of the purpose of these different documents. And then we're also going to talk about critical thinking that I hope you can adopt as a tool that will help you make better ethical decisions or feel more confident in the decisions that you make when you are serving patients and families. So thank you for being here, because the fact that you're here shows that you want to do what is best for everybody that you serve, and I really appreciate that. Okay, so let's get started. So first, this is our agenda. We're going to talk about what is a code of ethics. So we're going to talk about that like in general, and I'm also going to use the National Code of Ethics as an example so we can talk about like the different elements, their importance, etc. We're going to talk about the core values that are included typically within a code of ethics. We're also going to talk about principles, standards, and the examples that are provided in the national standards. We're also going to talk a little bit about session management. And the reason why we're going to talk a little bit about session management is because I think that we often get confused between all of these different terms. And I want to make sure that we're all on the same page and we understand what I mean when I'm talking about the national standards. What is it that we're talking about when we're talking about principles, session management? So it's kind of like a bit of an overview, because I think that if we are not all on the same page about the purpose of these different documents, then we might get a little bit lost and then not really be able to apply critical thinking when we're making ethical decisions if we don't understand the purpose of all of these documents available to us. And then at the end, we're going to practice a little bit on how to apply critical thinking whenever you're troubleshooting or thinking about the best solution for an ethical dilemma that you encounter. Okay. So what is a code of ethics? So in general, right? A code of ethics is it establishes the moral expectations for a member of a group. And it can also be that yourself as an individual, right? You have your own moral expectations. Now, if we're talking about a profession, then we're talking about like the moral expectations for the members of that particular profession. And it guides the behavior that is expected from the members of the group. So what is acceptable, what isn't. So within a code of ethics, and I'm sorry, before I move on to that, I want us to be clear that there's something that is called a code of conduct, and there's a thing that is called a code of ethics. Now, typically code of conducts, they're very objective, they're rules and they're sanctions. So it's like you have to, for example, if you work for an institution where you're expected to clock in on time, then you know that if you don't clock in on time, there's going to be a consequence, right? So that is more of like a code of conduct. But a code of ethics is more subjective, and it's more it provides guiding principles, and you typically follow it because there's a moral obligation to do so. Okay. Now, I also want to say that they are institutions and they are certifying bodies that use a code of ethics as part of their code of conduct. So they can say, if you don't adhere to what is included in this code of ethics, then you can get sanctioned. Okay. However, the code of ethics itself, it's really subjective, and it talks about moral obligation and guiding principles. It doesn't say like, if you don't respect the cultural differences, then we're going to sanction you for $50. So that is what all I'm trying to say here. But as I said, there are many institutions and certifying bodies that do use the code of ethics as part of their code of conduct. Okay. Now, within a code of ethics, there are core values. So in essence, a core value is like, what is it that you value the most? What is your fundamental belief, right? And this can be when you're talking about a profession, or it can be when you're talking about yourself, because all of us have core values, and we have our personal code of ethics, so to speak. Okay, so what I want you guys to do now in the chat, can you write a core value, one of your personal core values? And John, if you can help me reading those answers, please.
Absolutely. So everyone, if we could post our core values. So we have transparency, integrity, respect, accuracy, truth telling, respect, honesty, family, advocacy, boundaries, a lot, confidentiality, fairness, accountability, honesty, respect. I can't keep up.
I think those are very good examples. So I think you
Dignity.
guys definitely understand what I'm trying to say. Thank you, John. So yeah, those are all great examples of core values. Now, I am going to make reference to the national core values, the ones that are in the National Code of Ethics, because that is the one that I know well. As John mentioned, I'm part of the ethics and standards work group for the National Council of Interpreting Healthcare. So that is why this is the code of ethics I'm making reference to. However, there are other code of ethics out there, like CHIA, we have IRD, IMIA, and even though they don't spell out their core values, if you read it, you would be able to identify them. However, in the National Code of Ethics, they are spelled out, and they are identified as beneficence, respect for the importance of culture and cultural differences, and fidelity. Okay, so those are the things that uphold the most importance, like the most important thing. And I'm sure there are many others, but these are the three that were identified there, right? And now, if you look at these, they are very vague, right? That they're very abstract concepts. It's like, okay, beneficence. Okay, what does that mean? Okay, so beneficence can mean that it means that like I do no harm. Like I do. Some people think about, like charity work, or making sure that everybody has access to what they need, etc. So there are many things, right, that come to mind when you think about beneficence. Then when you think about respect for the importance of culture and cultural differences, there are many things there, right? Like cultural humility, making sure that you're recognizing that you're not the expert on the culture of the person that you're assisting. All of these different things that we can think about when we think about respect for the importance of culture and cultural differences. The same thing goes with like fidelity, right? Fidelity can mean many things. So these concepts are very abstract. So we have to like bring them down a little bit so we can understand, okay, but what does that mean within this framework of interpretation, right? So in order to do that, then it's like, okay, how can I support them? I need a little bit more guidance. We need something more specific that brings this abstract concept into the real world, so we can understand as interpreters how we should be behaving, or what behaviors we should be showing, so we can support these core values. Okay, so if you come down another step, then you're going to the ethical principles. So the National Code of Ethics includes the core values and includes the ethical principles. Okay, so principles, as I said, they provide guidance on how a person should behave whenever they're trying to support morals, values, and beliefs. Okay, so now think a little bit about earlier when I asked you guys to share a value. Okay, so think about that value that you shared, and now try to explain to me how will you show others that that value is important to you? How can you make that more concrete? Okay, can you share an example in the chat?
Through behavior, integrity, behave the same way even when no one is watching, by practicing it myself. From Jean Milford. Always use the usted form when speaking Spanish. Follow through, communication, behavior, speaking up by being exact through action, explain that it is important to me, abiding to standards through the golden rule, lead by example, accuracy by demonstration, courtesy, lead through action, clarification for interpreting, and I've lost that one. Interpret everything, nonverbal cues of empathy, interpret everything being said, advocate for client when there is misunderstanding. I could go on. There's a lot.
No,
Show
no, no.
respect for where interlocutors are coming from. Advocate self-conduct, being professional and preparing continuously. Mention to patient all info will stay confidential. Giving a clear introduction, explaining my role, respect, consistency, treat others as I want to be treated, eye contact, truthful, advocate, always keeping all parties in the communication loop, commitment, these are great, not showing my personal opinion, showing respect, integrity,
Awesome.
making
Okay,
sure you're active listening.
thank you very much, John. And I think some of those examples that you guys shared, I think fall into the realm of more of what we're going to discuss further. There are like standards, right? They're more like the how to, or more like the best practice. But when we're still at the level of like an ethical principle, it's still a little bit broader, right? So I included here an example of one of the ethical principles that is included in the National Code of Ethics. And this principle says the interpreter treats as confidential within the treating team all information learned in the performance of their professional duties while observing relevant requirements regarding disclosure. So this is an example of an ethical principle. And now what I want you guys to do is think about the core values that we just discussed. Which one of these core values do you think this ethical principle is supporting? And I'm going to leave them here on the screen so you guys can look. Okay, I'm going to give you 1 second to read it again. And then I'm going to ask you that in the chat, you write down the name of the core value you think this ethical principle is supporting. Okay, here are the core values. And John, if you can help me read the answers, please.
Sure. So fidelity, beneficence, respect, communication, fidelity, respect, trust, beneficence, respect, confidentiality, a lot. Fidelity, confidentiality, respect, a lot of fidelity, and a lot of confidentiality. All of
Okay.
them in trust.
Perfect. Thank you. So then when we're talking about the core principles, there are these three here. So I heard many of you mention fidelity. Some of you also mentioned beneficence. And I can definitely see how this principle doesn't have to just support one of the core values. It can be all of them, right? Because when we think about confidentiality, when we maintain information confidential, it's a way of saying I respect your autonomy as a person, and you have the right to have medical treatment that is confidential, and you have the right to feel safe whenever you go to a doctor, knowing that nobody's going to share the information that you discussed during that encounter. So that is definitely supporting beneficence. And then when it comes to like the other core values, you can also find a connection there, right? So all of those answers were correct. The only part is like, I know some of you mentioned like confidentiality. It's like confidentiality is more within the ethical principle realm that is supporting those core values. However, as I said, this is me making reference specifically to the National Code of Ethics. And there are other code of ethics that might have confidentiality as a core value, right? So I just want you guys to make sure that this discussion, like I am using the National Code of Ethics as the reference. So now when it comes to standards of practice, I want us all to be clear that standards of practice are not the same thing as principles. Standards of practice are a best practice or a benchmark. It's like, if you do this, typically you will have a good result. So that is what we're saying, right? We go from core values to principles to standards of practice. Okay? And as I just mentioned, a best practice is an action that has been used consistently and it has proven to produce good results. Also, some people think about like scope of practice when they think about standards of practice, right? Like, what are my boundaries? Like, what are my limitations? Now, specifically with the National Code of Ethics, they have I'm sorry, I need to go back a little bit. They include within the standards some examples. And sometimes I feel that interpreters get confused and think that if the example is not there, then there's nothing to do, right? It's like, well, I went to the standards and I saw the examples, but there's not an example that specifically talks about the situation I just went through. So I'm stumped, like, what do I do? But I want you guys to understand that those are just examples. But whenever you are lost or you need more guidance, you should think about, what are the values? What are the guiding principles? Go a step above, right? And try to understand, like, what are my goals within this encounter? And that will help you troubleshoot. And we'll talk more about that later. But I just want you guys to understand, like, what is the purpose of each one of these documents and what is contained in each one of them. So now I want you guys to think about, what is a best practice? What is a standard that you what is a practice, a best practice or a standard that you typically use whenever you are interpreting? And please drop it in the chat. And John, if you can help me.
Absolutely. So asking for clarification, showing up 15 minutes early, that's an important one. Punctuality, pre-session, interpret in the first person, good listener, never stay alone with a patient. All these are perfect. Clarity, being neutral, professional introduction, asking for clarification when needed, consistency, always bring note-taking pads. What else? Continuing education, accuracy, always be transparent, interpret everything that is spoken and expressed through facial expression, maintaining the register, verbatim rendering, being
Okay.
empathetic towards the client.
Thank you very much, John. Okay. So now here I included an example of standards. This is standard number 1 of the National Council of Interpreters in Healthcare. That states that the interpreter renders all messages accurately and completely without adding, omitting, or substituting. Okay. Now, within this standard, there are some examples of that, how that would look like. Okay. And in this example that is provided for this particular standard is that the interpreter repeats all that is said, even if it seems redundant, irrelevant, or rude. Okay. Now, I want us to go back to that standard. The interpreter renders all messages accurately and completely without adding, omitting, or substituting. Can you guys give me another example of how this plays out within a session? that is different from what is written in the national standards.
Let's see. Can you repeat the question, Fabiola?
Yes. Okay. So my question is, this is the standard. This is standard number 1 in the National Code of Ethics. Okay. And it states that the interpreter renders all messages accurately, completely, without adding, omitting, or substituting. Now, under this standard in the document, there is an example of how this plays out when you are in a session. And the example that is provided is, for example, an interpreter repeats all that is said, even if it seems redundant, irrelevant, or rude. Now, if you guys were drafting examples for this standard, what would you write? Can you give me your example for this particular standard?
And so there's a lot of wonderful examples in the chat. I'm just picking out a few. Patient has dementia and repeats the same story or is incoherent. Mental health. Cultural mediation is key. Patient asked not to interpret something they said. Swearing, profanity, pressured speech, praying during a panic episode, low education level.
Thank you very much.
You're welcome.
So I am glad that somebody in the chat mentioned, like, what if the patient is constantly repeating the same thing, right? So that it means that even if they repeat the same thing a million times, then I have to repeat it again. Now, let's also think about other situations where perhaps interpreting everything could be detrimental to communication, right? Because we also have to think about that, right? Because if we only look at this that says that we always interpret everything and we don't omit, then I think we might get stumped in many of the situations that we encounter, because I'm sure some of you have been in the situation where you go to an encounter and they tell you, oh, I speak a little bit of English. However, sometimes I don't know how to say this, or I don't know how to express this. Can you stay and help me out? So in that situation, you're not interpreting everything. However, you're still being an interpreter. So that could be an example of, oh, sometimes, when we're talking about interpreting everything, we're talking about interpreting everything that is needed to be interpreted, right? And maybe for this person, it means like 10% of the message. And for this other person, it's 100% of the message, right? So there are many different examples that we could create under this standard where we're saying, yes, we're still saying the same thing. We're still upholding this idea that we interpret accurately, completely, without adding, omitting, substituting. However, we all recognize that we live in the real world, and there are many situations that perhaps the people that wrote the standards didn't think about when it was written, right? So whenever we get stumped, that's what we have to think about. Okay, let me think about, what is the principle? What is the value? What is the standard? And then I can come up with my own example of how I adhere to all this and how I respected it, but that matched the situation that I was in. Now, the other thing that I want us to talk about is session management, because there are many wonderful trainers out there, and sometimes, because the time is so limited, whenever trainers are training interpreters, sometimes perhaps their guidance can come across as like a rule or the only thing that can be done, right? And that is unfortunate, because sometimes interpreters believe that, okay, if I wasn't able to apply what I was taught in this encounter, then it means that I did the wrong thing. Or honestly, I didn't know what to do because in my training, this wasn't discussed, or they didn't give me an example for this. And I think it's very often the case that strategies for session management get confused with ethical principles, and they get confused with standards. Okay. Like I have heard many people say, oh, you should never talk to the family in the waiting room, or you should never talk to the patient in the waiting room. So you have to avoid socializing. And it's like, okay, but that is a way to avoid something else. That's just one strategy, right? What we want to avoid is bias, right? We don't want to hear information that we don't want to hear because it might influence our rendition, or it might get us into a tricky situation where we're like, oh, I heard this, and should I share it, not share it? So truly, that is what we're trying to avoid. But that doesn't mean that, sitting in the lobby and saying good morning and the weather and all of that, that is a problem. However, sometimes we get these tips regarding session management from well-intended trainers, and we just adopt them as rules, or we think that they're part of our standards or code of ethics, but they're not. They're just an example of how we can avoid not adhering to the code of ethics, or not, yeah, not adhering to the code of ethics. So can you guys give me an example of um, a tip or something that you were taught during your training course when it comes to session management, that you think that often gets confused with a principle?
So a session management strategy that'll get confused with an ethical principle or a standard of practice. Okay.
Correct.
Appearance of, let's see, setting boundaries ahead of time, avoiding eye contact to encourage patients to speak with one another, have your eye tablet turned towards the wall between providers. I've had patients complaining to me because the interpreter seemed rude, did not want to answer my questions, did not have to do with medical or personal, just a normal question. That's
Okay.
one. That's a good one.
Thank you. Yeah, no, those are great examples. And I really love that example of avoiding eye contact.
Very true.
When you think about avoiding eye contact, why is it that we're trying to avoid eye contact? It's mainly because we're trying to promote direct communication. And that is awesome, right? Because that is something that we're trying to do because we respect beneficence, we respect the autonomy of the patient. That is fantastic. We're trying to promote direct communication. However, that is not always the best way to go about that, because we have to also have respect for cultural and cultural differences. For many cultures, not making eye contact is rude. So just making a blanket statement and saying you should always avoid eye contact, that's not going to work for every scenario. That's not going to work for every encounter or for every culture, right? So that's why I hope that today when you leave, I want you guys to start thinking about why is it that why do I adopt this? Why did I adopt this practice? Where does this practice come from? Is there a different way that I could still achieve the same goal? But that it meets the needs of the encounter that I'm in and the people that I'm helping. So, and we're going to move on in a little bit into like the critical portion of this training, but that is what is going to be one of the big takeaways from here. It's that I want you guys to start questioning why you do the things that you do, and not just simply say, oh, because this is what my trainer told me. Okay, that's great, and maybe your trainer is right, but take the time then to understand where does it come from and what other options you have, because sometimes that one strategy you learn won't be effective. um, so then moving on, I'm going to give you also some examples that I have encountered. Like when we talk about positioning, right? That is a session management strategy, because we value fidelity. Then we also have this principle of accuracy, right? And that, so when we're using positioning, we're using positioning to achieve those goals, right? We're saying, oh yeah, it makes sense for me to stand here because I can hear everything. If I can hear everything, then I can interpret accurately, etc. Right? However, I know that in many trainings, they tell you that the best positioning is where. Can you guys tell me, like when you took your training, where did they tell you that you had to position yourself? Like what was the best positioning?
So let's see, behind the patient, behind the client, trying not to be the center of attention, usually a triangle, closer to the client, behind the doctor. Physical therapy introduction, deaf patient may have nerve muscles issues that makes head turning painful, so we have to accommodate and be aware. Yeah, slightly behind the
Okay.
client.
Okay, thank you very much. So in my experience, they told me that I should always stand next to the person who needed my assistance. And when I mean well, they both need my assistant, but I mean it's like the LEP. Always stand next to the LEP because of power dynamics. They said, if you side with the clinician, then that might be intimidating for the person that you're assisting, the patient, right? So that's what I was taught. So whenever I was in a session where I have to position myself in another area of the room, I would feel very icky and I would feel very awkward because it's like, no, I'm not supposed to be standing here. Like, I'm supposed to be standing where they told me, right? And then with time, I realized that really, when you're in that room, you're pretty much dancing. You're moving yourself around, trying to find the best position so you can capture the message and you can promote that direct communication. I work in a pediatric hospital, and those of you that have interpreted in a pediatric hospital or have worked with a family that is not language that is language discordant, like whenever there's like a different needs within the same family, you know that positioning is very tricky and you have to like dance and strategize and find a way that you're positioning yourself in a way that you are helping the person that needs your assistance without getting in the way of the other people in the room that might want to communicate in English, right? So it happens a lot in my hospital where the parents, you have two guardians, right? And one guardian speaks English and the other one doesn't. Or sometimes both guardians need your assistance, but the child speaks English. So in those cases, I am like, okay, if the child speaks English, then the child's probably interacting with medical staff, right, in English. So then I have to position myself next to the guardians because they probably are the ones that are going to need for me to interpret what they're saying, what the child is saying to the clinician, right? If it's just for example, the mother that needs my assistance, okay, then I'm going to stand next to the mother because she's the one that needs my assistance, but in a way that doesn't interrupt the communication that perhaps the father wants to have with staff in English. Sometimes when we interpret medical rounds and we have multiple speakers, I also have to like move around and stand closer to the person that is speaking so I can hear what is being said. I have to use my hands so they know where it is. So what I'm trying to say is that we might have a best practice and something that works well, but that doesn't mean that that's the only way to do it. Like, there are other ways, that other strategies that you can use to achieve the goal. And the goal in this case is accuracy and fidelity. There's also, like, I also have heard about modes of interpretation, that consecutive interpretation is the preferred mode. And yes, consecutive works very well most of the time. However, there are some situations where switching to simultaneous might be more effective. And for example, in my hospital, we have a trauma bay that is open. So, and the parents can stand in front of the room and watch the medical providers work on their child. And when that happens, we're standing next to the parents, and simultaneous interpreting is what works well for us because we're not going to ask the doctors to slow down or pause so we can interpret everything. We just have to go with the flow. And in those cases, it looks more like what people refer to as legal interpreting, right? I hear that all the time. Like, they prefer more for healthcare is consecutive, and for legal is simultaneous. However, in my experience, there is room for both in healthcare. So those are just some examples of like practices that we have learned on session management that sometimes we confuse with a standard or we confuse with a principle. So now we're going to move on into critical thinking. And I have touched a little bit on this already. Critical thinking pretty much is just adopting an inquisitive mindset. You're not just doing things because, oh, I'm doing this because in my company they told me this is what it was when they trained me as an interpreter. And I'm referring to like ethical stuff. Right now, there might be other rules within your company about other things that, right, I'm not going to speak to those because they're very particular to the setting that you're working in. But sometimes we learn something, And we're stuck with that, and we don't have more tools because we don't think about the why. So what I want you guys to do is I want to encourage you guys to start thinking critically, and start questioning why you do the things that you do. So spend a little bit more time thinking about why instead of how. And this is not something that is going to happen overnight. This is something that you have to practice. It's something that takes time. Like, it's an everyday thing. Like when you, for example, let's say that somebody tells you, oh, this is how you're supposed to do this, then ask more questions. Then why is it that I'm supposed to do it that way? What is it that we're trying to achieve here, right? Like the example that I gave earlier about positioning. It's not that the only positioning allowed is next to the LEP and taking one step back. No, they're just telling you that typically that works well, but at the end of the day, what we're trying to do is to maintain accuracy, fidelity, and promote direct communication. So if you understand that those are the goals, then you're like, oh, okay. So as long as I am achieving those goals, then it doesn't matter if I'm standing somewhere else, because maybe in this particular case, that's what I need to do to achieve those goals, right? And you can do this with everything in your life. Whenever it's raining, why is it raining? What causes this to rain? Questions like that. And as I said, and this is not something that you're going to develop overnight. You just have to make the decision that you're going to start doing it, and you have to start practicing. Here's another definition of critical thinking. It's the propensity and skill to engage in an activity with reflective skepticism, right? Like not just taking things for granted, like, oh, because they told me to. No, you take the time, you reflect, and with a healthy skepticism, you approach the information that you're receiving. It's also skillful, responsible thinking that facilitates good judgment because it relies upon criteria, is self-corrective, and is sensitive to context. Okay. So here's another definition of critical thinking in the ethical context. According to Fashion, critical thinking in the ethical context involves the ability to analyze and evaluate ethical issues and arguments, identify ethical principles and values, and make informed and ethical decisions. This includes being able to recognize biases and assumptions and consider multiple perspectives and apply ethical reasoning to real-world situations. Okay, so as interpreters, how can we use critical thinking when we make a decision? Okay, first of all, make sure that you study the code of ethics that is available in your field. Maybe that's IRD, that's CHIA, that's the National Council. Make sure that you know these documents well, what they say, and what is the purpose of these documents. Okay, spend that time reflecting on what are the core values, what are the principles, what are the standards. And it can be, and they can have different terms, right? Like every document talks about principles in a different way or uses a different term. I have heard like IRD, I believe it's tenants. So they're different names, but pretty much most of them are referring to the same things. Also think about the session management strategies that you have used on a day-to-day basis. And think about, can I create new ones? How can I create new practices and new strategies that still support the values, principles, and standards? To give you an example, we are often taught to say the interpreter needs to clarify whenever we need something. Why we do that? We do that because we want to make a difference between our voice and the voice of the LEP, right? Or the voice of any of the speakers that we're assisting. But you can think about, like, is there a different way to do this? Is there a way that I can still achieve this that is not necessarily saying the interpreter? Because maybe it feels weird to talk about myself in the third person or saying the interpreter. So maybe that means that I will introduce myself at the beginning of the session and say, my name is Fabiola and I am the interpreter. And because I introduce myself, now everybody knows that this is Fabiola. And maybe what you want to use, and I have heard Andrea Henry said this before, you can say, hey, this is Fabiola. Right? This is Fabiola. I need to clarify this or that, because maybe that's more natural to you, right? But that is just an example of how you can start thinking about the things that you do, and how you can build new strategies based on what is it that I want to achieve. So guys, we're gonna go over this scenario real quick, and then I want you to share in the chat your thoughts on it. So I'm gonna give you 1 second to read it, and I'm also gonna read it out loud. The patient you just assisted with interpretation approaches you after an appointment to let you know she doesn't have a way to get back home. You are expected to be at another appointment and lack time to address the issue. Okay. Now, if we're adopting our critical mindset, right, then we will have to stop in that moment, right, and think about, okay, what are my values as an interpreter? Right? What is it that I value the most? What are my core values? What are my principles? So, and then based on that, you can make a decision and say, okay, so what are my gains and what are my losses, depending on the choice that I make here? What would happen if I stay? What happens if I leave? Right? And then after you analyze that, then you can make a decision that you will be at least at peace with, right? Because you're always going to lose something. So in this case, you know, I'm going to let you guys answer before I tell you what I think about this example. So, what would you do in this situation?
So let's see. Director to staff. Tell the provider at the front desk, we can't give a ride to anyone. Assist the patient finding someone to provide the transport. I would direct her kindly to speak to the site staff and tell her I need to be on time at another assignment. I will turn down her request as I have to be impartial with my client. Ask personnel to get social work and use telephonic interpreter. As a human, I will accommodate the client even if it is inconvenient for me.
Okay. Thank you very much, John. So, I like those of you that said, is there anybody else that can help, right? Can I connect this? Can I connect you with somebody else who can provide that assistance? However, you also have to keep in mind that doing that also takes time, right? And there's another person that is waiting for you. So whatever time you're spending on this person, you're sacrificing the time with the other person. And that's why I say that there's always gains and losses depending on the choices that you make, right? Now, I think we probably all agree that we should do something about the situation because we value beneficence, right? So, like walking away and just letting the person figure it out doesn't feel like the right thing to do. Now, what we do to address it then varies, right? Depending on what you think you should be doing next, depending on like maybe that next appointment. I know that the staff is very good at using video, for example. And I'm like, well, if I stay here a few minutes, I'm sure they're managed with video versus let's say that you know that you're the only resource. And then you're like, I really would like to stay longer with you, but I really have to get to that other appointment because it's going to affect that other person, right? And thinking about what other options do I have, like as you guys mentioned, like talking to staff or just telling the person, hey, just go to that reception desk and say interpreter. They will be able to get a phone interpreter who will help you, and then you can coordinate transportation, right? So this is an example of how you guys can use critical thinking to make the best decision. Now, this is our last example, and I'm going to go through it real quick because I want to make sure that I leave at least like 7 minutes for you guys to ask any questions. Okay. Um, so I'm going to read it real quick. You're interpreting for an accompanied minor. As you're exiting the room, the minor asks you to stay. How do you proceed? A, you explain you cannot stay in the room. You explain you cannot stay in the room. However, you will ask if there is another staff member who can stay. You say, I cannot stay in the room. However, I will sit outside and leave the door open so you can see me. You can agree to stay or you can do something else. So what I want you guys to do is right now, you don't have to write in the chat, but think real quick, what will you do? Don't give it too much thought. Just like the first thing that pops in your head.
I'm seeing a lot of C's. You say I
Okay.
cannot stay in the room. However, I will sit outside and leave the door open. And I'm seeing a lot of B's. You can explain you cannot stay in the room. However, you will ask if there's another staff member who can stay.
Okay, perfect. So then now what I want us to do is to think about all of the options. Okay. I don't want us to jump into right or wrong or what, like, no, I want us to think about all the options that we have and think about what are the gains and what are the losses here, right? And what action you can take that is going to be the closest to what our code of ethics says and our standards of practice and guiding principles. Okay. So first, if you say, I cannot stay in the room, can you guys tell me what are we sacrificing there if we just say, I cannot stay in the room? Or what are we gaining if we say that? Can you write it in the chat, please?
What are we gaining if we say we cannot stay in the room? Patient trust, lose trust, lose rapport, sacrificing patient trust. We may give a wrong impression, patient confidence lost, impartiality, preserve impartiality, lose rapport, credibility.
Okay, so I see that you guys have more losses than gains from what John shared. But you're right. Like you could say, well, if I explain that I cannot stay, then I'm upholding impartiality. And I am trying not to hear information I don't want to hear. And I don't want to become biased, or I don't want to give the impression that I'm stepping out of my role, because sometimes that is a concern for interpreters as well. But then I think most of you were like, I think really what I'm going to lose here, it is that trust, is that rapport that I have with the patient, right? What about B? You explain you cannot stay in the room. However, you will ask if there is another staff member who can stay.
So you explain you cannot stay in the room. However, you ask if there's another staff member who can stay. Maybe the patient doesn't want another staff member, not the same. Avoid accusations of behavior with a minor, but they want you, better option. Professional yet kind, trust is lost. Advocacy.
Yeah, thank you very much, John. And I'm glad that you got somebody mentioned like we want to avoid being accused of misconduct, because that is a real concern. And we know there have been some cases out there of interpreters that have been accused of misconduct because they stayed in the room or they stay along with the patient. So they're all very valid, concerns. And that's where a lot of these things come from, right? That something happened, it set a precedent, and now sometimes because of that, trainers are very careful on the guidance that they give and want to be very specific, because they don't want interpreters to get into these situations where they can be legal action and all of that. So all of those are very valid concerns. However, if this was real life, I'm sure that there are other things that can come that would influence the decision that you make. Because if there's not another staff member, then maybe that's not a suggestion, because maybe all the nurses or everybody there is busy, right? Or there's nobody that can play that role, right? So that's another thing to consider. Then, and you guys, and I'm not going to go through all of them because I want to leave time for questions. However, this is what I want you to do, right? I don't want you to immediately reject something because, oh, I was told not to this, not to that. I want you to take the time to reflect on it. And maybe at the end of the day, it's still a no, right? But take the time to think about, why is it a no, or why is it a yes, or why is it that I'm going to proceed in this manner or the other manner, right? So we're going to skip quickly because, as I said, I want to leave time for Q&A. So the key takeaways, right? Within our national code of ethics, or within a code of ethics, there are values and there are principles. There are standards, and standards are best practices. And speaking specifically to the national code of ethics and national standards, they include examples of how to respect the standards, principles, and values. Critical thinking is a mindset. If you adopt a critical thinking mentality and you complement that with a vast knowledge of your code of ethics, you will make better decisions, because you will be able to create new strategies to address the situations that you encounter on a day-to-day basis. So don't let the guidance itself limit you, because when people write these documents, they cannot account for every single thing you're going to encounter. That's impossible, especially in human interaction. Therefore, you have to take the time to reflect, understand where these practices come from, and that will allow you to make medical ethical decisions. And I'm going to stop here. Thank you, everybody, for your time. And then now I'm going to let you guys ask questions if you have any.
No, that was fantastic. Thank you so much, Fabiola. So we have a lot of questions, and help me understand. I would like, so we have a code of ethics as a profession. We have standards of practice. They provide ways of handling the interpreting session. What you want us to do is go past simply thinking of those things as simple rules that are completely, just inscribed in stone. There's no going away around them. To think beyond it as, is this useful to the session? Is it not useful? Is that right?
Absolutely. Yeah, exactly. Absolutely. The principles or the code of ethics often gets compared to rules, and they're not rules. They are, they're guiding principles. You uphold them because you have a moral obligation. But as I said, with the exception of, like, sometimes certain institutions do use it as part of their code of conduct, and that is when they can become, rules. But if you think about them in themselves as concepts, they're really not that. And as you said, there's room there for you to say, oh, I'm a video interpreter, for
Yep.
example, video remote interpreter, and I don't see an example in the standards that feed my needs. But then think about, what are the core values? Think about, what are the principles? What is the standard, not the example? And is there a strategy that you can create on your own that will help you address that? Because at the end of the day, if you're in front of a jury and they ask you, like, why did you make this decision? If you can say, oh, because our code of ethics says this, our principle says this, then you're good, because you're doing exactly what you're supposed to do, right? So thank you very much, John, for asking that question, because that's exactly what I meant.
Absolutely. No, yeah, it makes perfect sense. And so let's see, we have a question from Maria Camarata. Where can I learn more about beneficence in interpretation?
So I would say that I would go to healthcare. I am pretty sure that there are some resources specifically for interpreters that speak about the value of beneficence, but it really comes from healthcare. We're just adopting that same value into our code of ethics, right? And when I'm talking about the code of ethics for medical interpreters, right? Because there are many other code of ethics out there for legal interpreters,
Mm.
but all the codes of ethics, like, we also have the code of ethics for educational interpreters. So
Yep.
many of their values and their principles come from the values and principles of teachers, right? And
Yeah.
education. So that's exactly what we do when we're talking about the medical, code of ethics. So I would say, try to study the code of ethics for doctors, for nurses, and they talk a lot about this concept of beneficence. That would be my recommendation.
That's excellent. So the code of ethics and code of conduct for providers talks a lot about beneficence.
The code of ethics for medical providers, they talk about beneficence, and maybe you don't even see the word because it's a very high register
It's
fancy
this.
word. However, that is what they're implying, where they're talking about, like, do no harm, right? That's what we're saying, providing everybody equal access to the services that they need. So perhaps you won't find in many of them the specific word, but you will find the concept because it's there.
Excellent, excellent. Oh, wonderful. Good to know. Good to know. Let's see. So, an ASL interpreter, here's a question. An ASL interpreter once told me that avoiding socializing completely damages a patient's sense of trust with the interpreter. So it is often inadvisable to avoiding chit chat entirely with the patient. What do you think?
Yes, I totally agree. That's what we were talking about earlier when I was referring to cultural and cultural differences, right? Within the deaf and hard of hearing community, that is part of their culture, that is how I build trust with you. It's in those conversations that we have, right, that are like informal or what you consider like socializing, like all of that is part of like the way you build trust and rapport. So that is why as I was saying before, that sometimes we adopt certain practices because they told us that this was the way to do it, but we're just very narrowing down to just one specific example and not thinking about
Everything.
other cultures or other situations. Yes, and we had that situation in our hospital actually, and we had a very good conversation with our ASL interpreters, and they
Mm.
educated us on that. So
That's
thank you for
wonderful.
reading
It's
that.
wonderful. No, no, excellent point. Excellent point. So let's see. A few more questions. Oh, and I just want to mention to everyone, so we're at the 1 hour mark. In order to get your CEUs, no need to hang out any longer. Everyone will get their CEUs within 24 hours of the webinar being finished. So by midday tomorrow, you get an email. Just we ask you download it. So everyone, you don't need to hang out any longer. We're going to start wrapping up soon. Fabiola just gave a fantastic presentation, and just wanted to see if there was anything pressing.
Yeah, and I wanted to add one more thing, John, about that last question.
Absolutely.
I also was going to say, but what matters is that you have the right strategies, and
Mhm.
you have and you are constantly monitoring what you're doing to make sure that you're not entering into conversations you shouldn't be having. So,
Yeah.
because that is really what you're trying to avoid, right? Like you don't want that the person that you're helping think that you are going to advise them or that you're going to give them your opinion on what they should be doing or not doing, right? So there's a fine line there, and that is what you have to think about.
Small
um
talk.
exactly. So if it is small talk, but then it's like, if this moves from small talk to something else, do I know what to do? Do I know how to handle it? Do I have an exit strategy, so to speak, in this particular situation? So I wanted to add that as well.
Excellent. No, makes perfect sense. Along those lines, let's see. Uh, would love to hear your thoughts on the idea that the interpreter, particularly in a medical setting, is more of a bilingual facilitator of communication in their function than a mere interpreter of words.
um So for me, interpreters are part of the medical team. Like I always see myself as part of that medical team. Um, and that goes beyond just repeating words.
Got it.
That means other things, right? That means like you are bringing in your cultural knowledge, uh, perhaps even what you have learned about this patient in prior encounters. And I know this can be tricky when we're talking about contractors, because as a contractor, perhaps you don't have that continuity, right? I work in a pediatric hospital. We have staff interpreters. Those staff interpreters see the same patients probably every day. So
Yep.
they have that continuity, and sometimes they can, because it's within the treating team, because it's within the same institution. If there's something there that they're like, the patient said this, but because of what I learned yesterday, I think what he means is this other thing, right? They're bringing all of that as well, and that goes beyond just repeating the words. Um, so for me, there's also other things that you do, that what they talk about, like advocacy, right? There's certain things that you're like, well, because I know the community within this area very well, perhaps I know that resource that the let's say the patient asked, where can I get food?
Yep.
And the nurse says, well, I really don't know. And then you know that, oh, there's a social worker, right, that happens to know.
Yeah.
Or exactly. So those things where it's like you are sometimes sharing information that goes beyond just repeating words, because you are part of that 3D team.
Makes sense. Makes sense. Yeah, not thinking of ourselves as simply a tool. We're a human being with critical thinking, with humanity, with training, with skills that are contributing to the end goal, which is healthcare for this
Exactly.
patient.
Exactly. It's like you go to see your doctor, and within that session, let's say, for example, you're hungry and you share that with your doctor. And if it's appropriate, because you're not NPO, yeah,
If you're not NPO,
if you're not
and you're
NPO,
NPO if you just arrived.
and let's say that you share that with the doctor, and the doctor says, "Oh, you know what? I got some crackers, or whatever. Hey, here." Because now, does that mean
Yeah,
that he stops being a doctor? Now he is a social worker because he gave you food? Like, no, he's just being human, right? And he did a human thing,
yeah,
but he's still a doctor. And that's the thing with us. Like, we are humans. We have the role of the interpreter, but we're not just a tool, because there are other things that we bring to
yeah,
the table as
yeah,
humans. Yeah.
yeah, yeah. No, absolutely, absolutely. Um, okay, so a few more questions. Let's see. How should, and I just want to do a time check with you, Fabiola, and make sure you're good for a few more
Yeah, I'm
questions.
good. Yep.
Okay, fantastic. So from Mariana Lopez, how should we approach family members that speak in English in front of the patient when they know the patient cannot understand English?
Okay.
Ooh, that's kind of
So,
tricky. Yeah.
yeah, well, this one, I love this one. I gave a training on partnering with bilingual staff, and partnering with bilingual family members a long time ago.
Yep.
I think that, first of all, you have to set that stage correctly from the beginning, right? If you know that they are family members that are bilingual, then you should start that pre-session with an openness to a partnership, right? It's like, oh, you
Huh.
speak English. That is great. So I'm here to assist so and so. Um, if there's any information that you think is relevant, please feel free to jump in, and I will be interpreting for your family member. If I interpret something that is incorrect because I don't have as much context as you do, please correct me, right? Like, you do that right off the bat and set that stage and say, hey, we're here together. Like, I don't
Yep.
own, like, sometimes as interpreters, we want to take ownership of the encounter in the wrong way. Like, when it comes to flow management, sure, be confident, ask for what you need, absolutely. However, that conversation doesn't belong to you. It belongs to the person that you're assisting, everybody that is in that room. And it also belongs to that bilingual family member that is there to support, right? So I would say that is something you can do from the beginning. Now, if you already did that, and during the encounter you feel that there's still this person that is
That's
dominating the conversation, then you
yep.
can raise those concerns and say, oh, the interpreter or Fabiola, it just wants to let you know that I'm getting a feeling that perhaps the patient is not grasping everything that is being said, or that we're not leaving space for the patient to ask questions, right? And I always phrase that as perhaps, maybe,
Perhaps.
right? Because you don't want to speak for them. It's like, I'm getting this feeling, but that doesn't mean that's what you think, right? And then you repeat that back to them so you can give them an opportunity to say, oh, no, I'm fine, I'm understanding everything. Or they can say, oh, thank you, because I wanted to ask this question and I couldn't, right? So those are my recommendations when it comes to that.
I like that. I like that. So not necessarily doing it in such a tactful, sort of diplomatic way, because as a community interpreter, as a healthcare interpreter, you're thrown into a lot of situations that are it's just life. It's a little bit messy. It's gray.
Mm-hmm.
How do you navigate this without alienating portions of the family, um, and do it appropriately, right?
Yep.
So it's as you're either interpreting or you're mediating. If you're mediating, you're doing it as quickly as possible. It's like a surgical strike, pointing it out
Mm-hmm.
and getting back to it. Okay, very nice.
Yep.
Okay. Um, I'd seen another one. Um, oh, from Michelle Alba. This is a
Okay.
tricky one. What are some options when a doctor asks not to interpret part of the encounter?
Okay. So what would be the options? Okay. So when it comes to like strategies or like the house, like typically what I do is I will just depends. If they say interpret, don't interpret that, and
Yep.
then they say what they're going to say, that is very easy. I just say interpret, don't interpret that, right?
Yep.
And then everybody heard it in the room, right? Like the person that needed my assistant heard that statement, right? And they will ask a question and be like, but why do you want me to, right?
Yeah.
Now, the other thing I was going to say is that, because what we were saying before, like, we want to think about what are our values, what are our principles, what am I gaining and losing depending on the strategy that I use, right? You have to think about many different things. First of all, you have to think about, did I do a pre-session? Did I tell them right off the bat that this is how things go? Or did I had a discussion with them about how communication is going to go? If I didn't do
Session.
that, then it doesn't see then you have to think about, is this fair for this person for me to do this since I didn't set those boundaries right from the beginning, right? Maybe that's a moment to pause and say, the interpreter wants to remind everybody that everything that is said in the room will be interpreted, right? It's kind of like saying, hey, here's not giving a pass, but in a way saying, hey, this is a warning that we shouldn't be doing this, right?
Yep.
Now, you also have to think about what was so the other situations where they will give you the message and they will say, don't say this.
Mm.
And I can't tell you exactly what to do, because once again, it
Those
all
concepts.
depends on what's going on. Like what is the situation? What is it? What are you going to lose or gain depending on the action that you're taking in that particular moment? It happens all the time in our hospital when parents say, "Oh, I don't want my child to know about the diagnosis."
Yeah.
And the doctor already talked about that. So as an interpreter, are you going to say, no, I'm sorry, I have to
Yeah.
interpret everything. And if you don't want your kid to hear, I'm sorry, your kid already heard it. That is
Yeah.
very damaging to that relationship. And once again,
Yeah.
it's taking communicative autonomy
Away from the
away
parent.
from them, away from the parents, because the parents are saying, okay, you're here to assist me, and
Yeah.
I have control over what I want you to give or not give. So in a way, it's so, as I said, it's a tricky balance, and I think that that's why we have to reflect a little bit more on what is the standard, what is the goal, what I'm trying to get to, instead of saying, nope, I always have to interpret everything.
Got it.
Yep.
Got it. Got it. No, no, I think that makes perfect sense. So we have two more questions.
Sure.
And I just want last reminder to everyone. There's no need to hang out. If you need to go, completely fine. You will still get your CEUs. They'll be out via email tomorrow midday. So from Michelle, um, this is a bit of a tactical question. What are some ways we can reduce disruption when the doctor and or patient want to try to speak the other's language? And I
Okay.
think it's right in your wheelhouse, but it's not fluent.
Okay. So this is a provider that is not fluent, but uh, he thinks he is.
Yeah,
That
there's a lot of those.
okay. Well, it all depends on your hospital's policy. That's one thing. You have to think about what is the policy. We have to think about federal ruling as well. But at least in my hospital, that approach is, are you qualified? And if the provider says, no, I'm not, then it's like, okay, then I will need to take over the conversation, right? And then explain that to the family. But also be very careful with the words that you choose, because
Yeah.
I'm sure that 100% of the time, the LEP wants that medical provider to speak in their language.
Yep.
So you don't want them to feel like you're taking something away from them, because then it feels like, oh, my doctor was speaking Spanish to me and the interpreter told my doctor he couldn't speak Spanish to me. You're taking that away from me. So I would say what we do in our hospitals, we try to emphasize the importance of safety. We're doing this because of safety, right? If you're not qualified, then I'm going to help you because I want everybody to be safe, everybody to understand each other, right? Now, the other thing is, yeah, I think that would be my approach to it. And even let's say that this doctor is qualified, but you still like, man, what you're saying makes no sense. Then you can, yeah, because that happens. Then you can,
Then that's
yeah,
yeah.
but I would frame that conversation as, hey, because I want us to be safe and understand each other, because we all value, you and I, medical provider, we value beneficence. We want to do no harm. And
Yep.
because we want to do no harm, we want to make sure we understand each other. So let me help you, right? And I think that will be my approach, instead of
Excellent.
going into the whole, like, the law, federal,
just a more pragmatic, down to earth, kind of common sense
Collaboration. It's kind of like
collaboration.
it's creating that bridge of like we want the same things, we want the same outcomes, we share the same goals in this encounter, so let's help each other. It's not me against you.
And I think it's almost as if, and we're leading into the last question, and it's my question for you, Fabiola, but I think it's a great segue because it seems in a lot of ways as though the interpreting profession is starting to come full circle, which I think is wonderful. We're in the age of AI, we're in the age of a lot of remote interpreting, um, but we exist because it was the on-site, onshore interpreter that started first, so to speak. That was the first to do this. And so our code of ethics or standards of practice were written for an on-site, onshore world, and things are evolving. And so I would like to hear from you kind of maybe around you're on the NCIHC board and you're going through or committees and you guys are envisioning how do we update the standards of practice? I would love to hear because we get so many examples just looking through the chat. You can tell it's just community interpreters that have seen so much, and there's always a new scenario that no one had ever thought of. And yet, as community interpreters, as healthcare interpreters, we have to navigate this. How do you update a standards of practice for a new world that's changed post-pandemic, AI, a lot of things going on?
Thank you for that question. Well, how do we do that? We do it by, as a community, understanding what is the purpose of the standards, right? That's the first thing. Like, what is it what is the intention? What is the purpose of a standard, right? And then after that is participating in this whole process of updating the standards. We're going to hold focus groups in some of the major conferences that are coming up. CHIA, Paving the Way, we already did one for CCHI, and we're
Oh,
also
excellent.
going to hold some virtual focus groups, and we're also going to send out some questionnaires. So we need your input. Like, I can have many ideas of what needs to be updated. Our work group has many ideas as well, but you guys are out there doing the work and we want to hear from you. So I would say that the community will dictate what is missing and what needs to be updated. And we're also going to try to get some input from other stakeholders as well, like managers, et cetera. So we can have a good idea of what is missing or what is needed there. But the other thing I want to say
So
is
focus
that
groups. There's a lot of focus groups. Everyone
focus
should try
groups,
and get involved in a
absolutely.
focus groups.
Yeah, get involved. We want to hear from you. We want to hear
How do
from
you get
ASL
in?
interpreters.
How do you
Yeah.
get involved in the focus groups?
So for the focus groups, like the first, we're going to have two that are coming up, one in the CHIA conference, one in Paving the Way. And after we do that, we're going to send out an announcement to hold, we're going to send an announcement to recruit participants for the remote focus groups.
So
And
get
we
on
will,
your listserv, NCIHC listserv.
yep, that would be a
Okay.
great idea. And I'm sure we're going to partner with, CCHI and other, other great like cultural communication people that will help us get the
Absolutely.
word
Get the
out
word
there
out.
that we're doing. Yep.
Excellent. So you mentioned focus groups. Uh, Thank you, Andrew, for putting that link in there. I don't know, Andrew, if you could look up the NCIHC listserv, their link, but we have focus groups. That's number one. You guys will be at CHIA, paving the way. What else?
We're also going to hold virtual focus groups after we're done with the conference. So those are in person, and then based on the data that we get, and then we're going to think about when is it or how many more focus groups we need to hold
Got it. Based on
that are going
outcomes.
to be virtual. So yeah, and yeah, thank you very much for mentioning the National Council. Like, they have amazing work groups. So
Everyone should get involved.
yeah,
Needs
you should
board
volunteer.
members, need committee members, need
Absolutely.
contributors. What is the mission, Fabiola, of NCIHC?
I couldn't hear you, John.
What is the mission of NCIHC for everyone's benefit?
Oh,
Can you?
okay. Yeah. So the So our mission is like, first of all, like we want to make sure to create awareness on like what are the language access, regulations, what is out there, be very informed so that way we can inform the community as well. The Code of Ethics and national standards are a big part of it, like setting that standard for interpreters, right? To guide them through their work. We have so much in our mission, so many things that we want to accomplish, and we need volunteers. We have
Yeah.
many work groups that you could volunteer in. We could use your talents. So yeah, I encourage all of you to look into it.
Yeah. Yeah. No, the listserv is incredible because you'll see someone pose a question and then you'll see Cindy Rote respond or Catherine Allen respond, these legends. But everyone brings a unique, powerful experience because most people are practitioners, right?
Yes,
And they've
absolutely.
probably seen something that maybe someone else hadn't seen or thought of.
Yeah, I feel like I'm meeting with celebrities all the time because I am in the National Code of Ethics and Standards of Practice work group, and Maria Paz, Jane Contrimas are in that work group. And Maria Paz, she was the one that held the focus groups for the first Code of Ethics,
When?
and yeah, that was 20
In
years ago.
20,
Uh,
2006? Was
yeah,
it 20?
so
Yeah.
she was there for it from the beginning. So it's amazing to get to ask her questions about why is it that you guys wrote this? Why does this make the cut? But it's very humbling to be in those meetings with these powerhouses, right? That have so much knowledge, but yet they're so humble and willing to share knowledge. So that's another huge benefit from becoming a member of the National Council and participating in these work groups, because the networking, the wealth of knowledge you're going to
Yeah.
acquire is incredible.
That's awesome. No, that's wonderful. And I think it's definitely time to revisit the code of ethics, the standards of practice. So thank you, Fabiola, for being
Thank
a
you for
part of
having me
that.
here.
Thank you for joining us today. You're obviously always welcome back. As soon
Oh,
as you have
thank you.
a presentation, just let us know. We'll schedule a webinar. Um, and again, thank you, everyone out there. Thanks so much for joining us. We're here every first Wednesday of the month. Um, Please reach out. Any questions, concerns, comments, feedback. We certainly want to hear about this. We want to be a resource for you guys. So also bring a friend. That
Yeah.
certainly helps to expand the audience. Thank you guys. Thank you so much, Fabiola.
Thank you for your time. It was a
Talk soon.
pleasure.